Dr. Sahithya Bhaskaran. That's the first one. Comparison of accommodation lag in myopia using MEM retinoscopy and open field autorefractometer. Please go ahead.
Good afternoon. I'm Dr. Sahithya. So I'll be talking on the comparative assessment of accommodation lag using MEM retinoscopy and open field autorefractor. So accommodation lag has been linked to myopia progression, and a lot of newer treatments mandate accommodation lag to be measured in children with myopia. So the primary objective of this paper is to compare the agreement between MEM retinoscopy and open field autorefractometer to measure accommodation lag. And as a secondary objective, we also wanted to see the prevalence of accommodation lag in simple myopes. So the inclusion criteria was children with simple myopia with a spherical equivalent of less than -6 diopters and astigmatism of less than 1 diopter, age between 5 to 15 years. All of these children were spectacle adapted at least for 4 weeks. Exclusion being high myopia, ocular pathologies, previous surgeries, children on low dose atropine or myopia control lenses, and an astigmatism of over 1 diopter. So we had a larger cohort of 1,575 eyes with simple myopia for whom glasses were prescribed, and accommodation lag was defined as anything over plus 0.75 diopters. Of this cohort, 60 eyes were randomly chosen to assess accommodation with open field refractometer, and all the 1,500 children had accommodation assessed with MEM retinoscopy. The lag was measured at 40 centimeters, and we also did a follow-up at 6 months to see if progression was, there was some difference with accommodation lag and progression. So the mean age was around 12.43 and the spherical equivalent was -2.38 plus or minus 1.23. Of the 1,575, the accommodation lag was seen only in 196 eyes, accounting for 12.44%. And if you look at the myopia, the most of the lag was around -1 to -3 diopters of simple myopes. Risk factors, decreased outdoor activity and use of near gadgets was the most common. And coming to the actual results, so MEM retinoscopy of the 60 eyes identified 25 eyes, 41.67% with lag, whereas the open field autorefractor identified only 13 eyes, 21%, which showed lag. And at 6 months, again, MEM retinoscopy showed 30 eyes, which was a 50% lag, and open field showed in 19 eyes, 31.67. The overall agreement between them was 70% at presentation, 72% at follow-up. However, these eyes that proceeded to show lag after a 6-month follow-up did not show progression of myopia essentially. So the sensitivity at presentation was 40% for the open field autorefractor and at 53% at follow-up. Specificity was 91% at presentation, 90% at follow-up. A positive predictive value of 84.2% and negative predictive value of 65.9. The overall agreement was only 71.7. The open refractometer we saw was picking up lower cases with accommodation lag, whereas with normal accommodation it had good specificity. And now coming to the regression analysis, we saw that for every unit increase in spherical equivalent, the odds of having lag of accommodation were 13% higher, which means the lower the myopia, children had more accommodation lag. So closer to they were to emetropia, or the milder the myope, the odds of having accommodation lag was high. So we looking at this, we wanted to know if what was it in the general population. Then we realized from literature that around 10 to 20% children in this age group, even if they were emetropes, they still had a accommodation lag. So maybe it's not myopia that's causing the accommodation lag, maybe it's there in general population around this percentage only. So MEM retinoscopy clinically still holds to be the standard for measuring accommodation lag. An open field autorefractometer showed only a moderate agreement, but a lower sensitivity. And again, the prevalence of accommodation lag in myopia itself was pretty less, and there was no significant correlation between the lag and the progression in our study. So to conclude, it as a quick screening tool, yes, it works well. But again, MEM retinoscopy and open field were showing only a moderate agreement. So MEM still holds good for accommodation lags. And the prevalence of accommodation was also not very high in myopes. So now the recent protocol mandates that every child be seen of myopia be seen for accommodation. However, looking at these numbers, maybe it is not important to look for every child with accommodation, but if symptoms of asthenopia or something come up, then we can do it on a regular basis. The limitations of this study, We didn't have a control arm to look for accommodation lag. It was only a cohort of simple myopes, and again a larger group of children are required to validate these results. Thank you.
Okay, thank you. Dr. Dadeya, please come. Can we have a chair? Excuse me. Can we have a chair?
आप इधर बैठो.
Let us have at 4 minutes. Let us have a ring so we know. So please do one chair here. So thank you, Dr. Sahithya. That was a nice study. I just want to know, do you have, because you said myopia prevalence of accommodation lag is not so high, we must have a norm also for the, that was not done. Is there any comparison with other studies where normal
No, I'm not writing. Conflict of interest.
We did not have a control arm with emmetropes in this study, but compared to literature where there is a study by Dr. Rizwana, where in South Indian population they have seen, and that reports around 10 to 20% emmetropes having accommodation
but
lag.
here you got about 40, is it?
No ma'am, here lag was 12.4.
12.4. So what is the reason you think after 4 weeks of wearing glasses at the time of presentation?
For binocular vision, at the 4 weeks adaptation was for all children. Accommodation lag itself was not measured on day 1 of giving spectacle, because every child has to be spectacle adapted before binocular vision sets its tone to normal. That is why every child was seen only after 4 weeks. The second ad presentation and the second measure was at 6 months follow-up. We wanted to see if progression of myopia was also corresponding to the lag of accommodation, but there was no significant association between both.
Thank you.
Thank you, ma'am.